What is a migraine? A migraine is a neurological disorder that causes repeated attacks of moderate to severe head pain along with other symptoms. Unlike a normal headache, a migraine affects different parts of the brain and nervous system, which is why people often experience nausea, dizziness, or sensitivity to light and sound in addition to pain. A migraine attack usually lasts between 4 and 72 hours if left untreated. The pain is often throbbing or pulsing and commonly affects one side of the head, although it can occur on both sides. Some people have migraines only a few times a year, while others may experience them several times each month. Migraine is a real medical condition. It is not caused by weakness, poor eyesight, or simply being stressed. Understanding this is the first step toward getting the right treatment. Migraine versus a normal headache. Not every headache is a migraine. A common tension headache usually causes mild to moderate pain that feels like pressure or tightness around the head. Most people can continue their normal activities despite the discomfort. A migraine is usually much more intense. The pain often becomes worse with physical activity and is commonly accompanied by other symptoms such as nausea, vomiting, sensitivity to light, sensitivity to sound, or even strong smells. Some people also experience an aura before the headache begins. An aura may include flashing lights, zigzag lines, blind spots, tingling in the hands or face, or temporary difficulty speaking. These symptoms usually disappear before the headache reaches its peak. Because migraines involve many symptoms besides head pain, doctors classify them as a neurological disorder rather than just a headache. What happens inside the brain during a migraine? A migraine starts because certain nerve cells in the brain become unusually active. These changes activate an important pain pathway called the trigeminal nerve, which carries pain signals from the head and face. The activated nerve releases chemicals, including one called CGRP, that make pain-sensitive tissues more sensitive. As a result, the brain becomes much more responsive to normal things, like light, sound, movement, and even smells. This is why many people with migraines prefer to lie down in a quiet, dark room until the attack improves. The brain is temporarily more sensitive than usual, so everyday surroundings can feel overwhelming. Researchers also believe that people with migraines naturally have a more sensitive nervous system, making them more likely to react to certain triggers than people who do not have migraines. Why do migraines happen? There is no single cause of migraine. Instead, several factors work together. Genetics play an important role. If one or both parents have migraines, the chances of developing them are higher. Hormonal changes are another common reason, especially in women. Many notice migraines becoming more frequent around their menstrual period because changing hormone levels can affect the brain. Changes in brain chemicals, especially serotonin, are also thought to contribute. These chemicals help nerve cells communicate, and when their balance changes, a migraine attack may begin. Certain environmental and lifestyle factors can trigger an attack in someone who is already prone to migraines. These factors do not cause migraines by themselves, but they can start an attack in a sensitive brain. Common migraine triggers. Migraine triggers are different for everyone, but some are much more common than others. Stress is one of the biggest triggers. Lack of sleep, sleeping too much, skipping meals, dehydration, and emotional stress can all increase the risk of an attack. Some people are sensitive to bright lights, loud sounds, strong perfumes, cigarette smoke, changes in weather, or long hours in front of digital screens. Certain foods and drinks may also trigger migraines in some individuals. These include processed meats, aged cheese, foods containing monosodium glutamate, artificial sweeteners, alcohol, and too much caffeine. Suddenly stopping caffeine after regular use can also trigger a migraine. Since triggers vary from person to person, many doctors recommend keeping a migraine diary. Recording meals, sleep, stress levels, weather changes, and migraine attacks can help identify personal triggers and reduce future episodes. The different stages of a migraine attack. Not every migraine follows the exact same pattern, but many people experience migraine attacks in stages. The first stage is called the prodrome, which can begin several hours or even a day before the headache starts. During this time, a person may feel unusually tired, irritable, have food cravings, frequent yawning, difficulty concentrating, or neck stiffness. These early changes are the brain's way of signaling that a migraine may be coming. The second stage is the aura, which only occurs in some people. An aura usually lasts between 5 and 60 minutes. It may cause flashing lights, zigzag lines, blind spots, tingling in the hands or face, or temporary difficulty speaking. Not everyone with migraines experiences an aura. The third stage is the headache phase. This is when the pain becomes most noticeable. The headache is often throbbing, may affect one side of the head, and is commonly accompanied by nausea, vomiting, and sensitivity to light and sound. This stage can last from 4 to 72 hours if not treated. The final stage is called the postdrome. Even after the headache is gone, many people continue to feel tired, weak, mentally slow, or have difficulty concentrating for several hours or even a day. Types of migraine. Migraine is not the same for everyone. The two most common types are migraine without aura and migraine with aura. Migraine without aura is the most common form. The headache begins without any warning signs and is often associated with nausea and sensitivity to light or sound. Migraine with aura includes temporary neurological symptoms before the headache begins. These visual or sensory changes usually disappear completely before the pain reaches its peak. Some people experience chronic migraine, which means headaches occur on 15 or more days each month for at least 3 months, with migraine features on at least 8 of those days. There are also less common forms, such as vestibular migraine, which mainly causes dizziness or balance problems, and hemiplegic migraine, a rare type that can temporarily cause weakness on one side of the body and may resemble a stroke. Signs and symptoms. Migraine symptoms can vary from one person to another, but the most common symptom is moderate to severe throbbing head pain. Many people also experience nausea, vomiting, sensitivity to bright lights, loud sounds, or strong smells. Some become dizzy or find it difficult to concentrate. Others may notice blurred vision or feel extremely tired during and after an attack. Because migraines affect the nervous system, symptoms can sometimes appear before the headache starts or continue after it has ended. This is one reason why migraines can have such a significant impact on daily life. How doctors diagnose migraine. There is no single blood test or brain scan that can confirm a migraine. Doctors make the diagnosis by carefully listening to the patient's symptoms and medical history. They usually ask how often the headaches occur, how long they last, where the pain is located, and whether symptoms such as nausea, light sensitivity, or aura are present. They may also ask about family history, because migraines often run in families. Most people with a typical migraine do not need a CT scan or MRI. However, imaging may be recommended if the headache is sudden and severe, starts after a head injury, is associated with weakness or confusion, or has unusual features that suggest another medical condition. Treatment during a migraine attack. The earlier a migraine is treated, the better the chances of reducing its severity. For mild attacks, over-the-counter pain relievers such as acetaminophen, ibuprofen, or naproxen may be helpful when taken early. For moderate or severe migraines, doctors may prescribe medications called triptans, which are specifically designed to stop migraine attacks. Newer medicines that block CGRP are also available for some patients. If nausea or vomiting is severe, anti-nausea medications may also be prescribed. Along with medication, simple measures can provide relief. Resting in a quiet, dark room, staying hydrated, avoiding loud noises, and getting enough sleep often help the brain recover more comfortably. During a migraine, applying a cold compress to the forehead and drinking water may provide relief. Some people also find relaxation techniques such as deep breathing, meditation, or yoga helpful. It is also important to avoid taking pain medicines too frequently. Using them on too many days each month can actually lead to medication overuse headaches, making headaches more frequent over time. Medicines to prevent migraine. If migraines occur frequently or are severe enough to interfere with daily life, your doctor may recommend preventive treatment. Unlike pain medicines that are taken during an attack, preventive medicines are taken regularly to reduce how often migraines happen and how severe they become. Several types of medicines can be used for prevention. These include certain blood pressure medicines, anti-seizure medicines, some antidepressants, and newer medicines that block a protein called CGRP. People with chronic migraine may also benefit from Botox injections around the head and neck every few months. Not every medicine works for every person. Finding the right treatment may take time, so it is important to take preventive medicines as prescribed and have regular follow-up appointments with your doctor. Lifestyle changes that help prevent migraine. Medicines are only one part of migraine management. Healthy daily habits can also reduce the number of attacks. Getting enough sleep, eating regular meals, drinking enough water, and managing stress are some of the most effective ways to lower the risk of migraines. Regular moderate exercise, such as walking or cycling, may also help, although very intense exercise can trigger migraines in some people. Keeping a migraine diary is another useful habit. Recording your sleep, meals, stress levels, weather changes, and migraine attacks can help identify personal triggers. Once you recognize these patterns, avoiding or managing them may reduce future migraine episodes. Limiting excessive caffeine and avoiding smoking may also reduce migraine attacks. Maintaining these healthy habits over time often provides better long-term results than relying on medication alone. When a migraine needs immediate medical attention. Most migraines are not dangerous, but some headaches require urgent medical attention because they may be caused by a more serious condition. Seek emergency medical care if you suddenly develop the worst headache of your life. If the headache follows a head injury, or if it is accompanied by weakness, numbness, confusion, difficulty speaking, seizures, loss of consciousness, or vision loss. A headache with fever and neck stiffness should also be evaluated immediately. You should also see a doctor if your headaches become more frequent, change significantly from your usual migraine pattern, last longer than normal, or no longer improve with your usual treatment. Although these symptoms may still be related to migraine, they should always be assessed to rule out other serious conditions. Knowing these warning signs is important because not every severe headache is a migraine. When symptoms are unusual or different from previous attacks, it is always safer to seek medical advice. Final summary: living well with migraine. Migraine is much more than a headache. It is a neurological condition that affects the brain and nervous system, causing symptoms such as severe head pain, nausea, dizziness, and sensitivity to light and sound. Because symptoms vary from person to person, every migraine experience is different. Although there is no permanent cure, migraines can often be managed successfully. Understanding your personal triggers, maintaining healthy lifestyle habits, using medicines correctly, and working closely with your healthcare provider can greatly reduce both the frequency and severity of attacks. If your migraines are becoming more frequent or affecting your quality of life, do not ignore them. Early diagnosis and proper treatment can make a significant difference. The more you understand migraines, the better prepared you will be to recognize their warning signs, reduce your triggers, and manage the condition with confidence. With the right approach, many people living with migraines are able to reduce their attacks and continue leading active, productive, and fulfilling lives. That brings us to the end of this complete guide on migraine. If you found this video helpful, consider sharing it with someone who may benefit from it. And if you'd like to learn more about how the human body works and the science behind common medical conditions, be sure to subscribe. Thank you for watching.